With cooler weather right at our back door, a lot of people are seeking COVID booster and flu shots.
But you might be having a harder time than usual finding your COVID vaccine right now. Pharmacies are struggling to get enough supply to meet the high demand, at least here in Dane County.
Yeah, especially in Dane County. And parents have questions about what the school year will bring. UW Health's Dr. Jeff Pothof is here with his weekly visit.
Hi, Dr. Pothof.
Hey, guys.
We are so healthy here in Dane County. We just want to get shots.
Yeah.
And you can't get them.
Yeah, I think that's part of it. So certainly not as much vaccine out there as there was initially. And I think particularly if you look at a place like Dane County where there is lots of demand for getting these boosters, it's making it a little bit more challenging. We do have national pharmacies, your Walgreens and CVS's, some of the other large ones that have supply. You can get it, but it's not as easy as it was before where you could almost go like same day and get it. You gotta make plans for that. And then the health system's still waiting for our supply so that we can also offer it to patients. But
UW.
Yep.
The demand for this one is much higher than it was for the bivalent booster. Why is that? And
I think
what
it's
does that tell you?
a combination. One, there might have been a lot more bivalent booster out there, so it seemed like there was a better supply. Demand might have been similar, but I also think it's been a while. People realize that they haven't had a shot in a while. It's not like we've asked them to get vaccinated every couple of months. It's maybe been a while since they had COVID, and they know people who are getting COVID. You put those things together, and a lot of folks are saying, you know what? I'm going to go get vaccinated because I really don't have time to be sick in the next couple of weeks.
Plus the weather changing,
right.
too.
The other one was in the summer, right? The bivalent was like, it's summer, I'm not going to get it. But now we get flu season, and people are getting both shots at the same time.
Yeah, I mean, if you can do it, there's no harm in getting them separate. You can go one day get the flu shot, go another day get the COVID shot, but most of us don't like to go and get shots very often. So if you go, schedule one appointment, get your flu and get your COVID on the same day. That just seems practically the easier thing to do.
Same arm, other arm?
You could do same arm, but I might alternate it a little bit.
What is your recommendation for parents? A lot of parents are feeling some anxiety about the school year coming up.
Yeah.
Is this booster, are all kids eligible to get this latest booster?
Yeah, so kids 6 months and older eligible to get it. I think that's a good idea. Certainly the younger kids are going to have less likely a chance of getting severely ill from COVID-19, but not zero chance. Older kids more likely to get sick. I would say if you can, get your kid boosted. Does it have to be right now today? I wouldn't worry too much about kind of like the supply. Just get on the list, get it done, and move on. As much as it prevents those kids from getting more sick, sometimes having that milder illness is just kind of nice too, as they're trying to get homework done at home and do other things. So.
And we should emphasize this is not the spring of 2020.
No, even with COVID cases going up, if you compare, say, surges during the middle of the pandemic versus now, it's not nearly as many cases.
I mean, do you have to get the booster? What's your recommendation?
Yeah, I would get the booster. I mean, my kids will get the booster, I'll get the booster, wife will get the booster. I think anyone who's eligible for it, there's really no downside. The booster is so safe that I'm not even really thinking about that too much anymore. I know that I probably wouldn't get really sick if I got COVID, but there's no guarantee there. So why not just get boosted, increase my chances that I have mild disease and go on with the fall.
But the government's not paying for them this time. You have to use private insurance, or if you don't have insurance, you can go to public health.
Yeah, absolutely. I still think people will be able to get a free COVID shot if they want it, but it does take more work. If you have health insurance, figure out what's in network. Make sure you get it from an in-network provider. If you don't have health insurance, contact DHS, and they can likely let you know where there's some free clinics. Most children will be covered under this, so with a little bit of like elbow grease, you can find a free vaccine for COVID-19.
Because out of pocket, it's over $100.
Like $120, something like that.
Yeah.
All right, doctor, good to see you.
Same.
See you next time.